Welcome back to No Slouch No Ouch. My name's Mason.
My name's Alex.
But we're going to be talking about neurodynamics.
So, neurodynamics, what does that mean? It kind of sounds like a fancy word, doesn't it?
It really does.
Yeah, so basically what we're talking about is, it's almost like stretching the nerve, but really what we're trying to get it to do is to move through the muscle and soft tissue a little bit more fluidly than it is. So sometimes when we sit in static postures or our muscles get tight, it actually compresses those nerves and can send shooting signals down to the digits or the feet. So it's just kind of one of those things that we can address moving forward that also helps reduce the amount of pain that we do or experience. So nerves, just like our muscles, need to move effectively in order to operate effectively, and they're really, really touchy of pressure because they basically act like electrical wires that are pressure sensitive in some spots, but they have a lot of neural networks going through them, whether that be pain sensation, whether that be the things that tell our muscles to move or tell our muscles where they are in space. There's a lot going on there, and so when any of that's compressed, it changes the electrical signal and how that gets to the brain, and which is why we experience such things as pain or different levels of tightness or kind of like some weird sensations going down the arm throughout the day if we're not addressing that. So Mason's going to go over with us on how we're going to move through that and how we're going to progress to hopefully be a little bit more pain-free.
Yeah, well, the thing is with nerves, the first thing you got to remember is they take a lot longer to heal than on other tissues. So if we have you pull a muscle or something, you're going to feel better within probably 3 or 4 days if you do some exercises. Nerves, they don't have as much blood flow to the same kind of structure, so it's going to take you a lot longer to get that nerve to heal. So we're looking at more at weeks to possibly months if it's something bad.
Right.
With that being said, we'll go over the exercises and everything, but if you're having these symptoms that are just really bad and they just continually get worse or they're there for a long time, please go in and see a PT, see your doctor, get that checked out, because it's going to take a while. But we're going to talk about gliding and tensioning today. So what that means is gliding the nerve is we're going to kind of put it on tension a little bit and make it move through the soft tissues better. And one of the analogies I've heard in the clinic was it's like taking an extension cord and you kind of have it in a doorway. It's kind of like it's caught in the doorway, so you're just kind of moving it back and forth, get it to move better through the doorway.
Right.
And what we do with that is gliding. So let's say we have Alex. He's going to be my patient today. But what that means is for gliding, we're just going to take your nerve. There's a big nerve that runs through your arm here, and we're just going to put it on tension and then loosen it again. And then tension and loosen, tension and loosen. It's kind of like a dance move, really.
Then you throw the head into it.
Yeah, you throw the head. Yeah, it's good stuff.
Yeah.
And then to tension the nerve, it's kind of like almost a stretch, like you'd stretch your hamstrings. So we would put you in that position, have you put your head away, and then just have you hang out and hold it. And as that gets easier and easier, we move kind of from that gliding positioning, and then we move into stretching it and tensioning it, because it's a little bit more vigorous. And hopefully that'll get the nerve to calm down and let everything move a little bit better, and your symptoms will go down.
And the idea is to kind of take the nerve to a place where it doesn't necessarily see every day, like the kind of the amount of activity that it doesn't see every day, so that it's used to moving at a higher level than what you are actually experiencing throughout the day. Therefore, that we're giving you a little bit more freedom to move in a pain-free manner. All right, and with that, we'll get on to the exercises. Again, my name is Alex.
My name's Mason.
And we are No Slouch.
No Ouch.